In today's session, we are going to talk about how to approach a ulcer short case. So first, to do that, we have to know what is a ulcer. Ulcer is a breach in the continuity of an epithelial surface. So when examining an ulcer, there's the order. First, we have to do the inspection. Then we have to do the palpation with gloves. And third, we have to do the palpation without gloves. In inspection, first you have to see the site and size, then the margin, third the edge and the flow and the discharge. When we look for the site and size, in arterial ulcers, they are more commonly in the areas that are more prone to get decreased blood supply. Venous ulcers are more common in gaiters area in the medial malleolar region, and neuropathic ulcers are more common in sole of the foot. The margin. Margin is the line of demarcation between normal and affected tissue. In the ulcer, we have to say whether it has a regular margin or an irregular margin. So, a third one is the edge. So, edge is the place that connects the margins to the floor. There are sloping, punched, undermined, everted and rolled edges. Sloping edges can be seen in healing ulcers, and the punch out ulcers are seen in tropic ulcers, example like in diabetic foot, and the undermined ulcer edges are seen in tuberculosis, and the everted ones are seen in squamous cell carcinoma, and the rolled ones are seen in basal cell carcinoma. The fourth one is the flow. So flow means the exposed bottom of the ulcer. So it can be exposed tendons, bones, joint, or it can be a necrotic base. Also, there can be healthy slough or granulation tissue. The slough means the yellowish dead tissue. And in the granulation tissue, there is reddish and it can be bleed easily. For the discharge, if there is a discharge, you have to say whether it is a serous, sanguinous or purulent. If there is an odor with the discharge, you can tell whether there is an odor. Okay. So for the palpation with gloves, you have to palpate the margin and edges. For palpation without gloves, you have to palpate the area whether it is warm temperature and the regional lymphadenopathy, peripheral pulses and the peripheral sensation and the capillary refilling time. So what are the differential diagnoses? They are venous ulcer, ischemic ulcer, neuropathic ulcer, malignant ulcer, autoimmune ulcer and the mixed ulcer. According to your findings, you have to justify whether what kind of ulcer is this. Okay, so that is basically what you have to do in ulcer short case. Thanks.